Hello and welcome to our first live of 2022 for the Friendly Pharmacy 5 channel. Just a little bit of a tech check before we get started here. If you could let me know if you can hear me, that would be great because I don't want to get started until we know that you guys can hear what I'm saying here. So my name is Lindsay Dixon and I am a pharmacist from British Columbia, Canada. I started this channel in March of 2020, and I started the channel because I noticed that a lot of friends and family members, oh yes, thank you for letting me know you can hear me. I started this channel in March of 2020 because I noticed a lot of friends and family members had questions about the virus, about the pandemic, and some of these questions I could answer. And so that's how this channel got started. And since then, the channel has evolved into source of information. Hello, everyone. Nice to see you. Source of information, scientific, credible information about the pandemic, but also about other health issues. And so today's live is going to be primarily about the Omicron pandemic because that's what is really going on. And I think that's what is on the forefront of people's minds right now. However, hello, it is so nice to see all of you. I mean, I can't see you, but to get your comments. And this is really a nice chance to just interact with the audience here. And so thank you. We have people from Sarnia and from Arizona. Let me know where you are from, and we can kind of say hello to each other that way because it is a brand new year for all of us, right? So I'm going to share some data with you today, of course. And like I said, this is primarily about Omicron. As we do this, I would encourage you to ask questions in the comments, and I will do my best to get to all of the questions. If you have questions about the pandemic or the vaccines or any other health issues or questions that you might have, I cannot give medical advice online. However, I can give you information that might help you. And if I don't get to the question, I will go through them later. And sometimes it helps me to find ideas for videos for you guys. So thank you so much. So San Francisco, New Hampshire, daughter and I are waiting on Novavax. Yes, and I'm going to talk a little bit about Novavax as well today. So let's see. My slides are going to work. Okay, so a quick overview here. Let me know when I show you this if anything happens if there's any issues with audio or anything like that. Rhonda from Victoria, British Columbia. Hello, nice to see you, Rhonda. Close to home here. All right, so these are the daily confirmed COVID-19 cases per million people. Now, I know that this audience is incredibly well educated, and so they probably are quite well aware of the global situation, but I just thought that I would pick out a few countries here where some of the viewers from the channel are from. And I know I have viewers from a lot of different places, but these are some of the main ones. And you can see, look at Ireland up there, just kind of ahead of everyone else right now. This vertical climb with Omicron is really quite astonishing. And I'm going to get rid of this one banner here so you guys can see. There you go. So you can see the incredible climb of Omicron. And we'll talk about severity of Omicron in a minute as well. Now, if we go to, let's see here. Okay, COVID-19 patients in hospital. So there's good news and bad news here. There was a study out of the UK that was released, I believe it was yesterday, showing that their hospitalizations, though they are increasing quite substantially, the amount of people with severe illness that requires, say, hello from Scotland, hi Julia, people that require a ventilator, say, in hospital are quite a bit less. So the need for ventilation seems to be not as much of an issue with Omicron. Now, the problem is the incredible transmissibility of Omicron. We know it can replicate up to 70 times faster in the respiratory tract than Delta. And so this is what is causing these incredibly high numbers. It's an incredibly contagious virus. And I know that you all are well aware of that. But look at the United States. So I had someone recently say, look at what's going on in the United States. A lot of people are still going to events and doing a lot of things. And yes, life has been somewhat normal in some places in the United States, but they have paid quite a price for this. And so I'm not trying to be political, and I'm not trying to say that I would know better than public health officials. But look at the United States number of COVID-19 patients in hospital. And you can see that their Delta wave there, so about their third wave, they were just coming down from their Delta wave, and they did not even get as low as other countries. And now they're going up again due to their Omicron wave. And the healthcare staff in the United States is so taxed. They are so tired. And, we know that the United States has more healthcare capacity than, say, Canada. But the amount of death and the amount of complications, we know that long COVID is a big issue with COVID-19. And so letting this virus just spread through the communities like we see, we are going to see some long-term illness from this. And it is a concern for me. Yes, in the upper respiratory tract, that's right. It is a concern for me, especially when we think about children who cannot be vaccinated. But I digress. So I just wanted to share those with you. Now, most of us here, I feel so bad for our healthcare workers as well, because it's been hard for everyone. And people who are in hospitals, I don't work in hospital, have really seen this. We hear of friends getting sick, but we don't see them in hospital. We don't have to go through this on a day-to-day basis. And it does definitely take its toll. All right. So I wanted to quickly talk about how winter can change the incidence and severity, and not contagiousness, but the likelihood of us to get different respiratory illnesses. And I know this has been covered in other places, but I just wanted to remind you, many of us, if you're in the Northern Hemisphere, you're experiencing colder temperatures, you're experiencing winter right now, and this has an effect on our respiratory tract, okay? So I just wanted to show you some interesting graphs here. So this virus, and respiratory viruses in general, they really thrive in dry air, okay? So dry air occurs, and cooler temperatures. So dry air occurs when you are, say, in your house, right? So right now, the majority of people are congregating in their homes with their heaters on, and this really dries out the humidity in the air. So this affects, and I'll show you here, this affects the cilia in our respiratory tract. So if you're breathing humid air, you can see these little squiggly lines are the cilia, okay? So the cilia are usually just waving in the respiratory tract, and they're there to collect debris, to stop different viruses, bacteria, fungus from getting into the respiratory tract, from causing any kind of infection. And so usually these cilia are waving around, and they will slowly trap particles. But with humid air, it's much more likely that they're able to trap these particles more efficiently. And I believe there's a difference in temperature. So say it's 5 degrees cooler or 10 degrees cooler, the movement of the cilia actually becomes less as the temperatures decrease. Okay, so when you're outside, the cilia in your nose and your respiratory tract is not going to have as much movement, be as effective as when you're at, say, room temperature with, mild humidity. So you can see when you're breathing very, very dry air, a lot of those particles, viruses, fungus tend to get stuck there, and they kind of cover the cilia, and the cilia is also not able to move like it should. And so this is a concern, because right now we have a respiratory virus, we have Omicron, and we have flu, so influenza, we have RSV. And so you can see how in the winter we are more prone to respiratory virus in general. So that's why this Omicron, even if it is more mild, is still a concern for a lot of us, especially in the Northern Hemisphere. Any questions about that? I kind of went over that quickly. Yes, so air purifiers. If you have an air purifier in your home, or if you're able to buy an air purifier with a HEPA filter, that's something that I have in my home, and we've been using it. And I don't know if it's working, but I've seen the studies that show that it can filter out virus particles as small as the SARS-CoV-2 virus. And so that's something that we can do. Increasing ventilation, I always talk about this, is really important, especially if you have someone who is sick in your home. And I know it's cold out, but even leaving the windows open a crack, just trying to circulate that air. And reduce the viral load is really, really effective. And in the summer, due to air conditioning. Thank you, Elkie. That's right. And we saw this in Florida as well with their Delta wave, right? So everyone was going inside using the air conditioning. And we saw incredible spread during the Delta variant in Florida. So thank you for pointing that out, Elkie. That's right. Now, I want to, let me just see here. I've seen a few comments about Novavax. So I have a video that I'm going to release hopefully soon here about, I don't have a slide for you, about Novavax. Now, Novavax is, they just submitted the rest of their paperwork for FDA authorization. Novavax is a vaccine for SARS-CoV-2, for those who don't know, and it is different. It is not mRNA. It is not like AstraZeneca's, it is not a viral vector. It is actually a piece of the spike protein that they have harvested in moth cells, and then they have taken that out of those cells, and they've done, they call it washing. They've washed it, and then they've added what's called an adjuvant to this vaccine, and the adjuvant is there to help stimulate an immune response. Now, so in this case, it's different from the mRNA vaccines, because with the mRNA vaccines, it's the genetic code that is being inserted into the body, and then the body reads the code and produces the spike protein. In this case, the spike protein is the vaccine itself. And so the spike protein is injected into the deltoid muscle. And a lot of people are more hesitant about mRNA vaccines, so like Pfizer and Moderna, being that this is a bit new to us, even though it's been, I think, over a year now, but it's still a bit new. And a lot of people have been waiting for Novavax. And I've been waiting for it as well, because I do think a lot of people who are hesitant to get an mRNA vaccine might be more likely to get something like Novavax. Now, I will say that the type of spike protein that is used both in the mRNA vaccine, so the genetic code that codes for the body to produce the spike protein, as well as the Novavax vaccine spike protein, these are not exactly the same as the spike proteins on the virus. So they cannot infect cells. They cannot cause toxicity. They've made changes onto the spike protein, so it cannot do that. And I think that often gets lost in messaging, and we think that, oh, these spike proteins are toxic, and this is not the case. They cannot replicate. They cannot attach to your cells. They cannot fuse to the cells. So I think that's important. Anyways, so Novavax, hopefully it's on the horizon. I know that they have had some issues. They may be having some issues also with manufacturing Novavax, but hopefully it is coming. I know also that the trials for Novavax were done during the time of the Alpha variant. However, since then they have tested against other variants, probably not Omicron, but it is sounding like it's performing well against the other variants. Hello from your backyard in Victoria. I don't know if you're in my backyard, but hello. It's nice to see local people here on the live. That's great. Thank you so much for joining me. If you're just joining me, my name is Lindsay Dixon. This is the Friendly Pharmacy 5 first live for 2022. It's so good to see so many of you from around the world. I know it's a really hard time for a lot of us, and I just wanted to kind of come on here and say, Happy New Year, share some things about the pandemic and answer some of your questions as well. So you can leave your questions in the comments and I will try to get to them. And I will have a time for Q&A in just a few minutes after I share a few more slides, but feel free to just keep them coming. That's fine. And I'll try to get to them as I can. All right. So I wanted to also touch on something that is concerning me, because a lot of people have said, well, this Omicron is mild. I want to say to you right now, Omicron is not mild unless you are fully vaccinated. Some people will get mild illness, and they probably would have gotten mild illness with Delta as well, if that's the case, or Alpha. This whole conception that Omicron is mild is really concerning, because there are people who are at home who are very, very sick right now, and they're borderline on hospitalization. Just because people are being hospitalized and not needing ventilators does not mean that it's mild. If you are vaccinated with 2 or even the 3 doses, you are much more likely to have mild disease with Omicron. We know also that viral load is a big component, so how much virus you're exposed to. So if you were exposed to the virus outside and you did get some kind of infection, it's probably more likely to be more mild. Whereas if you were inside and having Christmas dinner with someone, you were in someone's house for 3 hours and that person was contagious, they were asymptomatic, then you're much more likely to maybe, depending on your health status, have a more severe infection. And that's going to look different for different people. It's concerning me that many are saying this Omicron is mild, and they're just kind of throwing caution to the wind. Let's not forget about long COVID. Let's not forget about some autoimmune conditions that we've seen arise after SARS-CoV-2 infection. And children are no exception. So this was just released from the CDC. So the risk for newly diagnosed diabetes more than 30 days after SARS-CoV-2 infection among people who are under 18, so we're talking about children here, is significant. And there's a couple different databases that have shown about a 30% increased risk. Another study showed about 166% increased risk for children who have had COVID-19 to develop type 1 or type 2 diabetes after infection. So part of the reason here is that the virus actually attacks the beta cells in the pancreas. And these are the cells that are responsible for producing insulin. So in this report, they say that healthcare providers should screen for diabetes symptoms in people under 18 years of age with a history of SARS-CoV-2 infection. So if you know a child who has had this COVID-19 infection, you could let the parents know or let the caregivers know. Watch for frequent urination, increased thirst, increased hunger, weight loss, tiredness, or fatigue, which many children have for weeks after the infection, stomach pain, and nausea or vomiting. If any of this is present, the child really needs to be assessed by a caregiver. But I was seeing pediatricians all across social media saying, hey, we're seeing a lot of diabetes in kids, like more so than usual. And now we are starting to see data that really backs that up. So letting this virus just spread through the schools, just spread through daycares, spread through the population is going to have consequences. And I'm not trying to scare anyone, and I'm not trying to be pessimistic, but I do think that even if Omicron is mild for us, we still need to do what we can to protect ourselves, to get vaccinated, wear masks, and not infect other people, especially if we are around those who are immunocompromised or children who cannot be vaccinated. Kids under 5 cannot be vaccinated right now. I have one of those children. It's quite a concern. Have you heard anything about how effective one dose of vaccine is for a 5 to 12-year-old? This is a great question. I actually just had this question on another social media platform. So a lot of kids in Canada right now only have one dose of vaccine because the interval between one dose and 2 doses in Canada is an 8-week interval, whereas in the US, it's a 3-week interval. And the reason for that is because in adults, it was observed that the 8-week interval actually provides longer lasting immune protection. Now, in certain provinces like Ontario, some parents have had the option, and some parents have opted to give their child the second dose of vaccine in about the 3 to 4 week interval. I'm in British Columbia. We don't have that option here right now. And it does come with an increased risk of myocarditis, although we are seeing with the mRNA vaccines in children that the risk of myocarditis is so incredibly small. And all cases that I've seen in the reports are mild, treatable, and the children recover quickly. And I think it's like 7 or 8 million doses, and there were 14 cases of myocarditis, and it was mild and treatable, and the heart does recover. Myocarditis is an inflammation of the heart. It is not dead heart muscle. It's not heart failure. It is treatable and usually quite mild. Anyways, a lot of parents only have the option of giving their kid one dose, and schools are going back in many places across Canada next week or within the next couple of weeks. So one dose in adults, so the study that showed the one dose efficacy in adults against Delta, and we're talking about the Pfizer vaccine here. So it was shown to be about 33 to 55% effective. So one dose of Pfizer, 33 to 55% effective against the Delta variant, okay? So we can extrapolate that to children. We know that children generally have less risk of severe disease with COVID-19. If the child is 2 weeks after their first dose, they definitely have some immune protection. We don't know exactly how much, but it's definitely better than nothing, right? So a lot of parents are really, really worried about this right now. And it's just kind of the circumstance that we find ourselves in. But I don't think that we should just disregard that one dose. That one dose is very important. It does expose the body to the spike protein, so it can recognize the spike protein. And the second dose is usually used for what we call immune memory. So it really activates those T cells that help to create immune memory in the body. So one dose is great, 2 doses is better, but some parents just don't have a choice right now, and it's just the situation that we're in. The spacing doses longer reduces the risk of myocarditis. Yes, it does. And that's why I was saying if you do the shorter interval, you do have a slightly increased risk of myocarditis. But a lot of physicians and infectious disease experts that I'm seeing online are opting to give their children the second dose earlier because they are seeing the risk of infection and the risk of myocarditis with COVID-19 being much, much higher than with the shorter interval. So that's the decisions that they're making. Some people have that choice and some people don't. So I don't think we should disregard that first dose. Even giving your child one dose is very, very helpful. About 2 weeks after, you definitely have some immune protection, though we do not know exactly how much. So yeah, that was something I wanted to share, was the concern about diabetes in children. We're fortunate to be able to homeschool. It'd be nice to get back to socializing again soon. Yeah, yes. I have friends who homeschool as well, and they just kind of think they have continued on, although their socializing is less. If you follow me on Facebook, Friendly Pharmacy 5 has a page on Facebook as well as on Instagram. And this week I posted something about diabetic ketoacidosis. So we have a lot of people right now who are sick with COVID-19, with Omicron, and they are managing this from home. And if they are diabetic, type 1 or type 2, because we know that type 2 diabetics are sometimes on medication that helps with insulin levels or even insulin. So if you are type 1 or type 2 diabetic, I would like you to pay attention, because we know that type 1 and type 2 diabetics can experience rising sugar levels when they are sick. People, when they are sick, they also don't eat and drink as much as they normally would. And so someone who is diabetic and gets sick really needs to pay attention to their medications, their insulin level, and how much they are eating and drinking. And they should be testing their blood sugar every 3 to 4 hours. Doctors in hospitals, I've not seen this in Canada yet, but definitely in the States, in New York, they're seeing a lot of hospitalizations of patients who have COVID-19, and they're also experiencing something called diabetic ketoacidosis. So when the sugar levels rise so high in the bloodstream and this sugar is not able to get into the cell, the body starts making ketones. And this can lead to a lot of different very serious symptoms, and it can progress to a definite emergency quite quickly. So signs to watch out for. So like I said, if you're diabetic, type 1 or type 2, and you get COVID-19 or any other infection, you should be testing more often, testing your blood sugar more often. So every 3 to 4 hours. You also need to continue to make sure that you are eating and drinking, but do watch your sugar content. Some of the main symptoms I'll show you here of diabetes ketoacidosis. It develops slowly, but once it develops, it becomes quite serious. So it starts out with being very, very thirsty. Now, a lot of people with a fever will already be very thirsty, right? So just watch for this. And then urinating a lot more than usual. If this continues over a period of time, it can develop into more serious symptoms. At this point, the person needs to be seeking medical care, hopefully earlier, but if this happens, this person definitely needs to get to hospital. Fast, deep breathing, dry skin and mouth, flushed face, fruity smelling breath. This is classic of diabetic ketoacidosis. And also, this happens when people get diagnosed with diabetes and they don't even know. One of the first signs often is fruity smelling breath, along with weight loss and a few other symptoms. Headache, muscle stiffness or aches, being very tired, nausea and vomiting, stomach pain. Something else we're seeing with Omicron is a lot of GI upset. So we're seeing vomiting, diarrhea, and I'll talk about that in a little bit if I get a chance. So these are some signs and symptoms to watch out for. If you have a friend or family member who is diabetic, just let them know, hey, if you get sick, you really need to watch yourself and watch out for these signs. You can do a screenshot right now of this and just send it to them. And they may already know, because a lot of diabetics know that on a sick day, they do need to make some adjustments and pay more attention to their blood sugars. But I just wanted to share that because I hope, that might keep a few people out of hospital if we can spread that message, okay? And that was from the CDC. Okay. It's great to see you here as well. All right, one more thing I'll share and then we'll go to the Q&A. How's everyone doing? Thank you so much for joining me. We've got about 46 people on here, which I think is excellent. My name is Lindsay Dixon. I'm a pharmacist from British Columbia, Canada, just sharing some things with you about Omicron and health in general. So do I know if there's an at-home plasma test kit? Not that I know of right now. No. If anyone else has heard anything, you can answer that question in the comments. All right. Treating COVID-19 at home. Dr. John is an internal medicine physician. He is on Instagram and Twitter, as well as TikTok, if you follow him. He is debunking a lot of myths right now about COVID-19, about the vaccines, but recently he put out some information that is really helpful, I think, for people right now. So many people are going to get sick, and so many people are going to be dealing with COVID-19 at home. So when should you call for help? He says if you have new or worsening shortness of breath or chest pain, and he says that that usually occurs on day 4 to 8 approximately. If you have an oximeter at home, your pulse oxygen level should be higher than 94%. If it's below 94%, you need to be seeking help. If you or someone you know is confused, lightheaded, significantly decreased urine output, these are signs that this person should be seeking medical care. If you are a more high-risk group, so if you have a chronic illness, or if you are, say, over the age of 65, you might be eligible for early treatment. There are some early treatments available, like fluvoxamine, which is an antidepressant, but it also has some anti-inflammatory properties and seems to have some efficacy in reducing severity of COVID-19. Budesonide is another one. It's an inhaled steroid that can be used to help reduce inflammation in the airways and has some evidence that it might be effective. Monoclonal antibodies, we only really have one now that works against Omicron, but those might be an option as well. So if you are in a higher risk group, these might be some options for you, but you would need to talk to a physician and get assessed before you'd be eligible for that. But these things only work really early on. So if you are in a risk group and you think you have COVID-19 or Omicron, you should speak with a physician as soon as possible. Just get a quick assessment if that's possible. He also says, so to avoid high doses of vitamin D, we know that vitamin D toxicity is possible. And when you're sick, your body does change the way that it balances out some of these I guess, vitamins and minerals. And he says not to take any more than 100 milligrams of zinc as well. And I'm not sure why, but I'm just letting you know. Stay hydrated. So broths are really good because they do have some salt in them. Electrolytes, especially if you might be dehydrated. So if you've had a lot of diarrhea, so Gatorade, Powerade is what we have here. If you're diabetic, you need to watch the sugar content. I believe Gatorade has sugar-free now, so just be aware of that. So replacement of electrolytes, especially if you've had nausea, vomiting, diarrhea. Paracetamol or acetaminophen, be careful, is fine for fever. Be careful with anti-inflammatories like ibuprofen, naproxen. These are otherwise known as Aleve, Motrin, Advil. Those can really cause issues in people who have high blood pressure, kidney disease, or any kind of gastric ulcer. So you really should talk to a pharmacist before taking anti-inflammatories. But in general, as long as you don't have liver disease, acetaminophen and paracetamol is fine. Although the max dose of Tylenol or acetaminophen is 4,000 grams in a day. And you really need to watch that, because if you're taking, say, Tylenol, and then you're also taking something for your sinuses because your sinuses are bothering you. Well, this has acetaminophen in it, and this also has probably 500 milligrams of acetaminophen in it. If you are going over 4,000 milligrams a day of acetaminophen, you could be causing liver toxicity, and this is something that is quite concerning right now. So be careful how much acetaminophen that you are actually taking in a day, and do not go over the max dose. If you take a medication that ends in pril or sartan, so like Ramipril, losartan, valsartan, anything like that, captopril, and you're not eating and drinking very much, talk to your doctor. These are blood pressure medications that may need to be adjusted if you're really not able to eat or drink much. We want to make sure that your blood pressure stays at an appropriate level. Don't make any changes without speaking to your doctor. And if you take immunosuppressing drugs, talk to your doctor because you may be eligible for some of these early treatments. So if your doctor thinks that you're fine to manage this at home, Dr. John recommends lying on your stomach. Deep breathing can sometimes help if you have mild symptoms, and lying on your stomach takes the pressure off of your lungs, which is what we've seen in hospital as well when they're proning people, right? Let's see if I can get to the second slide here. All right, so cough suppressants are okay as needed. In Canada, we have something called Buckley's. Don't use Buckley's. Maybe I shouldn't be saying trade names here. It's not effective. It doesn't work. It just tricks your mind into thinking that that awful taste is doing something. It really, really doesn't. Talk to your pharmacist for a good cough suppressant if needed, or of course, you'd be sending someone into the pharmacy. Rest is needed. Frequently change positions, walk around the house. You want to keep your circulation going. You want to keep your breathing going. It's really important that you do get up every once in a while if you're able to. And if you have other people in your household who are not sick, you should try to isolate as much as possible. Use your own bathroom. If you're using the same bathroom, make sure that it's cleaned after you use it, or have someone come in with an N95 and clean it. Also, you should be wearing an N95 or at least a double or triple layer mask if you're in the house with people who are not also infected. If you are sick, open the windows, use a HEPA filter. We've already talked about a little bit about that. And don't hesitate to seek help in case your symptoms worsen. Get out of your house and get some sunshine. You know what? That is important. But some people, when you're sick, especially when you're quite ill at home, it's not really the easiest thing to do. But yes, if we're healthy and if we're feeling good, it is important right now to get out, get some sunshine. It helps with our mental health. It helps with our physical health, and it helps also getting sunshine is also good for vitamin D absorption, especially in the winter. All right, that is what I think that's it that I had for you. But do you have any questions? Let me know. I'd really like to know how accessible. Let me know where you're from and how accessible is testing right now in your area. Testing right now in British Columbia is really complicated. They've actually told us not to seek testing unless we're symptomatic and a high risk category. I have like a rapid test here that I just was able to get 2 of these for our house, but a lot of people can't even get rapid tests. Whereas I know in places like Austria, it's like they're everywhere. Anyone can get them. So that's testing is quite complicated here right now, and it's concerning. Thoughts on second J&J shot versus Moderna or Pfizer booster? I definitely go with an mRNA as your second dose or your booster. I'm not sure what you're referring to exactly there, but that is definitely showing much higher efficacy than if you were to get the second J&J. I think that's what you might be asking as a booster. Definitely, I would go with mRNA. Moderna was showing higher efficacy generally after 2 doses or even 3. It really kind of was something that was showing to be more effective. But honestly, whatever you can get. And Pfizer is excellent as well. And really, we're talking about a few percentage points. So I wouldn't hesitate, but I would definitely go for mRNA based on the data that I've seen. That's a really good question. Teresa had sent me some questions ahead of time, and she was asking about supplements and the quality of supplements. And this is something I also wanted to touch on, because there are a lot of supplements out there, and in Canada, we don't really have a good system for determining what is a good high quality supplement. I often will just buy what is on sale. However, I remember a few years ago, I did read some literature about Jameson, and I am not receiving any money or anything like that from Jameson, but Jameson, I seem to remember there was something saying that their manufacturing practices seem to be somewhat superior to others. Now, Weber was also one that I think was fairly good, but I'm not recommending these. The thing in Canada is that we don't really have very good ways to assess the manufacturing and also the content, so the actual concentrations of what is actually in these vitamins. So the quality control is not necessarily there. So it's not really something I can recommend like one over another, but do be careful and try not to waste your money, because there are so many supplements out there that we take, and we don't really know are these working, and what is the real content of what is in them, and do they have good manufacturing practices? So Sylvia says, in Australia, no rapid antigen tests available in most locations. Many testing sites closed and limited availability to get PCR tests, with people waiting symptomatic for many hours. Yeah, like this is happening around the world. In Vancouver, I know people are waiting hours and hours just lined up to get a rapid test. Do you know how dangerous it is for people who are symptomatic to be lining up for a rapid test and then going home? Like, I think the transmission just around that area would just be, it's so concerning, and it's really not ideal. Over Christmas, I think we had maybe a 5 to 6 day wait in some places. And this is just the incredible demand that there is for PCR right now. Now, Holly also asked me if it's safe if you have adult asthma, is it safe for you to go shopping right now if you wear an N95? So the thing is, an N95 is very protective, and that is the best protection that you can get right now. Make sure that it's well sealed over your nose and under your chin. And something else that I wanted to talk about that I spoke about a few months ago, I did a video on this, was eye protection. Because the virus is airborne, it's aerosolized, and it can be transmitted if it comes in contact with your eyes. So I bought these last year, I think, when I was doing flu vaccines. And I'll put the link to these in the description of the live after. You can see that they don't look like safety glasses, but they do help to protect your eyes. They don't form a seal, but they are better than nothing. And I was in a room with probably 30 to 40 different patients in a very small room with very little ventilation for weeks doing flu vaccines, and I did not get sick. I was also wearing a mask. So you can see how these they help to form a bit of a shield. So if you want some added protection when you're going to the grocery store, when you're going out somewhere, this is something that I would be wearing right now, especially if you are asthmatic or if you have another condition, just to help protect your eyes. But also just try to limit your time in these indoor spaces. Just go in, get what you need, and get out. And I think that's also helpful as well. And also, of course, wear your mask. So Elke says, here the lineup outside can be up to a 20-meter queue. Yeah, we've seen lineups, wrapping around buildings, and there's just so much demand for testing right now. And it's a lot of some doctors are warning that if you do get COVID-19 and you don't have evidence that you've had it, and I'm sure they'll have to do something about this in the future, but if you have a rapid test or a PCR, you need to record that date, because that's the date that you would, if you need any referrals after your COVID-19 infection, say for long COVID or any complications from COVID, it goes from that date. So if you are not able to access PCR testing because it's just too overwhelmed, but you do have a rapid test at home, even if you don't consult with any other medical professionals, record that on your calendar or on your phone. This is the date that I received a rapid test, because that is your documentation should you need a referral for more care in future. Okay, so that's something that is really important. So wearing prescription eyeglasses gives a degree of protection. Yeah, I think so. In hospitals last year, maybe earlier than last year, we're so far into this pandemic now, they instituted protocols where all staff that were in hospital also had to wear, here in Canada anyways, also had to wear safety goggles. And a lot of people would wear these over their eye protection, but definitely glasses are going to give you a bit more protection. Remember, aerosols are like cigarette smoke though, right? So they're not going to really respect the size, right? But I think it's better than nothing for sure. Let's see what else we have here. Someone else had asked me, kids under 4, are we seeing increased hospitalizations like they are in the UK? And yes, we are starting to see that. Now, we are a little bit behind the UK. Oh, you want me to go full screen? Sorry. We are a little bit behind the UK as far as our pandemic goes, but places like Ontario are seeing more hospitalizations of children right now. And I mean, the sheer contagiousness of the virus, so many kids are going to get sick at once, right? So we are probably going to see that. What concerns me just as much as that is the issue with multi-inflammatory syndrome in kids that occurs about 2 to 6 weeks after infection. and can affect multiple organs, requires hospitalization. If all these kids are, even if it's a small number of kids that need this kind of care, if they all need it at the same time, it's quite concerning. And then, of course, the issue with long COVID, and like I showed you here now, some evidence that there may be more increased risk of diabetes in kids who've had COVID-19. So it's definitely something to consider here. Let me just get out of here. I didn't realize you guys were seeing my whole screen, but that's okay. Let me just remove this here. All right. Any more questions or concerns? Anything that I can help you with? I think that's all that I had to share. Let me just see where your comments are here. Taking vitamin K2 with D3, should I worry about blood clots? I haven't seen anything on this. I have seen that there have been recommendations of taking this vitamin with D3, but I cannot recommend that. I know that vitamin K2 is also available through different foods that we eat, eating a well-balanced diet. Another question that I had was, how do you get a multivitamin into a person who does not want to take one? And, eating a well-balanced diet, whole foods, that kind of thing are good. You can also crush up a multivitamin and put it in a smoothie or something like that. Yeah, so this has been really good. We have people from all over the world here. Question, would you consider a daily inhaler like Flovent something that will compromise immunity? Budesonide, which is Pulmicort, is a steroid inhaler that is used and has shown to be effective for early milder disease, COVID-19. And Flovent is fluticasone, so it is a steroid as well. Maybe you're asking me if you take Flovent daily, if that will compromise immunity. That would be a conversation to have with your doctor, because I know that early on, we were questioning even the use of some steroid nasal sprays, leaving people more prone to infection. But I do not know what the evidence is for that now. That's about 2 years later. And then you would also have to look at benefit versus risk, right? So is the benefit of Flovent protecting you from having difficulty with your asthma or respiratory issue? Does the benefit outweigh the risk of infection? And these steroid inhalers, often there's very little that is actually absorbed systemically for a very prolonged period of time. So that's a conversation that I would consider having with your doctor, but don't make any changes before speaking with your physician, because you don't want to exacerbate anything. And a lot of people in the winter, they do have more issues with respiratory conditions as well. And so we don't want to provoke any kind of a flare-up. Are boosters necessary for healthy individuals under 50? Boosters are being recommended for individuals who are over the age of 18, and even the FDA just approved for over the age of 12. We really do see increased protection with that third dose, and the second dose really does start to wane after about 4 to 5, 6 months. What we also see, though, is there is good protection from T cells, but that's very early evidence, and it's not something that we can really count on right now. And we are seeing high incidences, or higher than we've seen with previous variants, higher incidences of reinfection in vaccinated as well as unvaccinated. And so as I'm not sure where you are in the world, but yes, in Canada, the booster would definitely be recommended for anyone over 18, and that is based on the data that is available right now. How reliable is a negative rapid test? Thank you for this question. I had a slide here for you guys. So we're seeing a lot of people who have taken a rapid test over Christmas, thought they were fine, and the whole family then has COVID after Christmas. And so rapid tests are something that I think that we've had very little education on. It's important to remember that rapid tests are very, very time sensitive. So if you are taking a rapid test and you are asymptomatic before an event, it doesn't necessarily mean that you are not going to be contagious at the time of the event. So you need to take this test about 1 hour or 2 hours before the event. And some doctors have actually recommended taking one, say if the event is in the evening, take one in the morning and then take one in the evening. Well, rapid tests aren't that available. So maybe you only have one rapid test. If you do get a faint line, like a faint positive on your rapid test, take that as a positive, do not go out, stay home and isolate, and just wait for a day or two and see if you do become symptomatic, but don't be spreading this to other people. There is a really good reference from the BC COVID-19 modeling group. They did a presentation on how dependable these rapid test negatives or positives actually are. And it's not as simple as we might think. And also there are questions coming into play as to how sensitive these tests are with Omicron. And it's looking like they're much more sensitive if you are a few days into symptomatic infection. So detecting asymptomatic infection, they might be good for surveillance, but they're not diagnostic. So if you have a negative test and you are symptomatic, assume that it's COVID-19, and if you can test again in a few days, test again and you might get a positive. But if you are symptomatic and you get a negative rapid test, don't assume that you don't have COVID. Assume that it's COVID, isolate, and do all of the things that I've been showing you in this live. Thank you so much for asking me about that. I have some graphs and some information that I'll put in the description of this live so you can have a look at that, because we really have not had much education around the use of these rapid tests. Okay, well, I'm going to close here. This has been great. Thank you so much for all of your questions. Thank you for opening the new year here on the channel. It's been great. And send me your questions, comments, any kinds of concerns that you might have, and I will try to get back to you. I will be looking at the comments and questions later on today and trying to answer them to the best of my ability. Thank you so much. Take care and stay healthy. Bye-bye.